What should your vitamin D level be in the UKI? And how do you make sense of your blood test results? If you've recently had a vitamin D test and you're not quite sure what the numbers mean, you're in the right place. Vitamin D is essential for bone health and immune function, but a lot of people in the UK aren't clear on what they're actually aiming for. So let's break it down. In the UK, vitamin D is measured using a blood test that looks at something called serum 25-hydroxyvitamin D, written as 25, OH-D, and the result is given in nanomoles per litre or nanomoles per litre. This is the standard measure used by the NHS and NICE because it reflects both what you're getting from your diet and what your skin produces from sunlight. Here's how to read those numbers. A level of 50 nanomoles per litre or above is considered sufficient for most adults. Between 25 and 50 nanomoles per litre is classed as insufficient. Not quite deficient, but not where you want to be either. And below 25 nanomoles per litre indicates deficiency, which does require treatment. UK guidance doesn't recommend aiming for levels significantly above 50 nanomoles per litre for the general population, though research in this area is ongoing. Now, it's also worth knowing that vitamin D needs can vary from person to person. People with darker skin tones, those who are housebound, or those who cover their skin for cultural or religious reasons may not make enough vitamin D from sunlight, even in summer. The same applies to older adults, pregnant and breastfeeding women, and people with conditions like malabsorption disorders or chronic kidney disease. If any of those apply to you, it's worth having a conversation with your GP about your individual needs. For most people in the UK, the NHS recommends considering a daily vitamin D supplement during autumn and winter because from around October through to March, sunlight simply isn't strong enough for your skin to make adequate vitamin D. Some people may benefit from taking a supplement year-round, depending on their lifestyle and risk factors. Your GP or pharmacist can advise on what's right for you. One thing that's important to flag: vitamin D testing isn't routinely offered to everyone. It's generally guided by clinical need. So if you're concerned about your levels, speak to your GP or pharmacist first, and they can advise whether testing is appropriate for you. If a blood test does confirm deficiency, treatment doses are individualized and must be prescribed and monitored by your GP with appropriate blood tests alongside or including calcium levels. Never try to self-treat significantly low vitamin D levels, as safe correction of deficiency really does need proper medical supervision. And if you're buying an over-the-counter supplement, don't exceed the amount stated on the product label, and only use higher dose products if they've been prescribed and are being supervised by your clinician. If you develop any new or unusual symptoms, whether that might suggest your levels are too low or signs that something isn't right at the other end, contact your doctor promptly. So, to recap, in the UK, 50 nanomoles per litre or above is the target for vitamin D sufficiency. The NHS recommends a daily supplement during autumn and winter for most adults. Speak to your GP or pharmacist about what's appropriate for you. And if you're in a higher risk group or your levels are confirmed as deficient, always get personalized advice before making any changes. Remember, this video is for educational purposes only and isn't a substitute for personalized medical advice. For guidance specific to your situation, please speak to your GP or pharmacist. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.